The World Health Organization has also put out figures in which it states that air pollution is causing 7 million deaths a year, and this will, of course, significantly go upwards. Is this a trend that you have also been witnessing in terms of respiratory diseases, cases coming into hospitals, in which you do see a trend in which more and more people are getting impacted by the air around us?
Absolutely. I think this tendency is more in metro cities, and you would not find it much in tier 2 or tier 3 cities. But if you look at the levels of air pollution, my office just did some background research, and we have China, India, Pakistan, Indonesia, and Bangladesh topping the list. I think there's a sincere and serious requirement of SAARC nations coming in and Asia as a whole, which really needs to put together a commitment to battle air pollution. It's a silent epidemic. You would not see it in terms of how you measure disasters or how you would measure road traffic injuries. Because if, for example, a patient is suffering from a lung disease, he or she would go to their doctor, the doctor would treat it, the patient comes back. So you don't have a snowballing effect which is seen in terms of air pollution affecting a community as a whole. I mean, why is there much conversation revolving around New Delhi right now is because of visibility being so poor that it's evident that there's pollution in the air in terms of smog. But otherwise, you also have other cities around the world where the burden is equivalent. So the whole agenda here is to put more effort and investment into research to understand what policy decisions can be favorable in terms of public spaces, and to also collectively battle pollution as a human duty and not just a human right.
Right. Also joining us is Dr. Edmond Fernandes, community health physician and global health expert, joining us from Bangalore, India. Thank you both for joining us. Dr. Fernandes, now let me start off with you. Tell us, now with the state of how the environment is changing, and we talked about this in our segment earlier, how air pollution is causing more and more people to become sick each and every year. Do you think health facilities are improving at the same pace, and especially when we're talking about developing nations?
I think for health facilities to improve, we first need to bring healthcare discussions related to environmental challenges right into the medical curriculum, where we train the undergraduate students of medicine, and then we train the master students. So right now, if you look at the current syllabus, not just in India, but across Asia and around the world, conversations around environmental pollution for medical doctors is very limited, if not sidelined. And even these discussions related to environment do not really feature into examination questions. So there's an inner tendency of doctors and physicians in training to sideline or push environmental discussion, climate change and climate action effects on human health to an alternate form of reading, which you would probably classify under the nice to know kind of category.
So you would say way behind.
I wouldn't say we are way behind, but our priorities are conflicting. On one hand, you have infectious diseases. On another hand, you have, with increased urbanization, people are developing lifestyle-related diseases. And on the other hand, the Indian subcontinent or Asia per se is prone to disasters, where you have another sizable amount of your economy being spent in disasters. So where does air pollution fit into this picture, or even environmental needs? It's conflicting priorities for which we need a systems approach which brings in inclusion into medical dialogues, right, not just in and around hospitals, but across public health institutions around the world.
Right. For that, I want to jump back to Dr. Fernandes and talk to him about how, when we're seeing all these numbers, we're talking about all these costs. But as you also mentioned, it is certain parts of the world that will be facing climate crises at an accelerated pace. And we're also seeing it happen right now, India being one of them. Now, in all of this, do you feel like the regional government, the local government is making healthcare a priority?
Absolutely. I think with the Indian Prime Minister championing Ayushman Bharat, healthcare has been a priority for the Indian government like never before. I would also like to add to what Vicky Price was trying to say in terms of cost-benefit analysis. We have been championing the model of the doorstep doctor. And the bottom line of argument is that in today's day and age, if you have Amazon reaching your doorsteps, if you have pizza delivery guys reaching your doorstep, then why not take healthcare to the doorstep? So this cuts the cost of patients incurring indirect cost of coming to the health systems. You're taking a health team to the doorstep of communities and patient care. Secondly, you put in environmental experts and public health specialists who can teach and train communities on better sources of consumption in terms of fuel, where you move into solar energy, you bring in more sustainable ways of using fuel, which would eventually have a very strong impact on not just communities or local governments, but which would magnify across the world.
Right.
And it's about investing right and investing sufficiently, which will change the ball game of healthcare, not just in India, but anywhere in the world.
Right. On that point, thank you so much, Dr. Fernandes, for joining us and talking to us. That's the end of our show today, but thank you so much for watching. We'll see you again tomorrow with more stories. Till then, goodbye and take care.